Today is World Mental Health Day. It's a day to stop and ask yourself how you're doing and to acknowledge that it's okay to not be okay. But don't take that from us. We have brought in an expert for you this morning. Dr. Luan Phan is here to tell us all about mental health and how we should be talking about it. Good morning, doctor. Thanks for being with us.
Good morning. Thanks for having me.
So first, let's talk about how the topic of mental health has evolved over the years. It certainly has changed.
It has. I think there's still some stigma out there about talking about mental health, but I'm very encouraged to see that there's more being talked about from friend to friend, family to child, colleague to colleague at work. I think it's more relevant now than ever. And I think top influencers in our field, as well as in the sports field, has really talked about it. Yesterday, for example, Coach Ryan Day at the Ohio State University football team talked about mental health himself and how important it is to reach out whenever you're struggling.
Well, certainly many of us struggled through the pandemic, and it shaped the way that we deal with our mental health and also the way that we view it. How do you think that the pandemic made an impact?
The pandemic has been horrible for all of us, and I and many people believe we should call it a shared experience, something that almost everyone has been touched by in some way, and usually in a negative way. And so by having such a shared trauma, a shared stress, a shared adversity, it allows us to sort of have commonalities. And I think that's one thing that has kept mental illness in the shadows before, that we didn't see the commonality. But with the pandemic, I think we have a shared experience that we can all talk about.
And speaking of talking about it, some of us are very comfortable talking about that topic. Others are not. So who do you think really stands to benefit from this if we do talk more about mental health?
I actually think everyone stands to benefit from talking about mental health. Before the pandemic, statistics noted that one out of every 5 Americans was struggling with anxiety, depression, addiction, post-traumatic stress. Now that number, based on a report from the CDC, says that that number has doubled. So now 2 out of 5. So 2 out of 5 will want to talk about it. The 3 out of 5 should be the ones talking to the 2 out of 5 about it so that they can prevent it themselves. So everyone would benefit from talking about mental health.
Well, talking about it can be helpful, say, in therapy. But if people are not at that level or don't want to do that, are there some just normal everyday things we can do to take care of our own mental health?
Absolutely. The data suggests that the vast majority of us don't have an illness, but are just struggling, mentally struggling, cognitively struggling. And we advise sort of the common basics tools that you should use every day as much as possible. Eat a balanced diet, exercise regularly, reach out to friends, stay connected, stay social, form those bonds, don't let those bonds go away. And lastly, keep a routine and stick with that routine. And cut out the noise about the news, perhaps, maybe tune down the news a little bit rather than overwatch news, because that causes some stress on its own.
Well, doctor, thank you so much. We're just going to ask that people do not tune out until after our newscast this morning. But some great advice from you. Thank you so much. We appreciate it.